health watchdog says the pandemic has pushed dentistry to crisis point, depriving many patients of care. Healthwatch England says some NHS patients have been asked to pay for private dental treatment, while others have been told they face waits of between several months and 2 years. Well, let's find out a bit about what the situation is like here in Berkshire. Andrew Sharp is from West Berkshire Healthwatch. Morning to you, Andrew.
Morning, how are you?
Yes, I'm very good. I'm quite startled by that, though, potentially waiting several months or up to 2 years if you've got toothache. That does not sound pleasant.
No, it isn't at all. There's two things really at play here. There was obviously an issue with NHS dentistry well before the pandemic, funding, access, etc., and the pandemic's just made it much, much worse. Because obviously lots and lots of dental procedures need to take much longer in between patients because of the aerosol nature of the COVID pandemic. That slows down the amount of work dentists can do. So it's kind of two-pronged hit that we're already in a bad place with NHS dentistry, and the COVID pandemic has just exacerbated it and had a massive impact on the amount of work dentists can actually do. So there's only a couple of ways you can really get out of that, really.
So can people register for NHS treatment in West Berkshire? Is that still available, or would you struggle to even register at this point?
We have heard lots of cases where it is really, really difficult. We had one person who contacted us who had contacted 17 different practices across, would you believe, 3 counties and been unable to find it. We've got someone else we're actually trying to help at the moment whose elderly mother is trying to find an NHS dentist having moved into the area. We just didn't hear too much about this pre-pandemic, and now it seems to be, and it's what Healthwatch England found, almost the norm, that it's almost impossible to find an NHS dentist. And also, people who are in pain, need care, being told they have months and months to wait, but magically, if they can pay for it, they can be seen relatively quickly. So we're actually calling in our COVID report for an utter root and branch relook at NHS dentistry in this country. If they're going to reorganise the NHS, which they're talking about doing, they need to at last have a proper look at NHS dentistry and say, does it do what we expect it to do? Is it accessible? Is it equal? Can everybody around the country get and expect the same level of treatment? And also, we need to back up our community dentistry service, which has huge wait lists, but does the most brilliant service to people who are nervous or, some of our most vulnerable people. But they had long waiting lists well before the pandemic, so you can imagine what that's done with our most vulnerable. And then the other one that really shocked us, new mums get 12 months free dental care, and we had a survey out, and 18 out of 21 young mums couldn't access an NHS dentist, and there's been no opportunity to extend their 12 months, even though they haven't been able to go to a dentist. So lots of issues need looking at, and you cannot tinker with this. You need to, frankly, start again and look at it for the 21st century, look what we need, because oral health is so important. It affects all sorts of things, children's life chances. Any dentist will tell you this. We've got to have another look at this properly.
And so is anybody looking at it properly? That all paints quite a bleak picture. It's one thing to say it needs changing. Is anything happening?
It doesn't look like it is, to be honest. And part of the problem is that because health locally, is commissioned by the clinical commissioning groups on a sort of area-by-area basis, but NHS dentistry is actually commissioned by the NHS itself. So in a way, we can go to a CCG board meeting and sort of raise questions or what have you. It's really difficult to do it with NHS specialist commissioning. I personally have never actually been in the same room with them. So, they're just too distant. And I would really like all health to be controlled by the same body. Why is it, we've only got, say, physical and mental health controlled by our local health board, but not dentistry? It's turning it into a bit of a Cinderella sort of profession. And if you can basically afford good oral health, you're fine. And if you can't, you're not.
So what advice would you give at this moment if somebody's sitting at home, they're in pain with their teeth, or they need treatment? What's the advice?
Well, I think you've got to obviously ring round as many people as you can. I think, contact your local health watch. There's one in every local area or authority. Write to your MP. The MPs really need to pick this up. This is a really serious matter. You said, is anyone doing anything about it? Honestly, I just don't hear the noise. They're reorganising the NHS again for physical and mental health, but I haven't heard a peep about dentistry. So again, it's sort of being left as if it was an effect, effectively, of when the NHS was formed, that dentistry was a sort of add-on. And oral health is as key as every other kind of health. You've got to look at the holistic person. If they can be super fit with everything else, but they've got gum disease and their teeth are falling out, that doesn't make them a healthy person. So currently, the local CCG, Clinical Commissioning Group, have no responsibility for oral health. So when you ask them a question, they say, it's not us. So we have to join this up. If we are going to have another reorganisation of the NHS, dentistry needs to be at the heart of it, as other major programme boards.
Okay, Andrew, thank you very much. Let's